everyone. This is Felicia Brown with One Concept Radio, where I'm getting to know experts and educators from the massage, chiropractic, acupuncture, and spa professions. Today, I'm here with James Waslaski. James Waslaski is the author of Clinical Massage Therapy, A Structural Approach to Pain Management, as well as 7 orthopedic massage and sports injury DVDs and several other manuals on advanced orthopedic massage and client self-care. In 1999, James received the FSMTA International Achievement Award and in 2008 was inducted into the Massage Therapy Hall of Fame. Welcome, James. We're so glad to have you here today.
Thanks, Felicia. It's always an honor to be part of all of the conferences that your group do. It's great to align with the chiropractors and the acupuncture people. It's an amazing opportunity.
Well, we totally agree that we're lucky to have you as a part of our conferences and wanting to help people get to know the way you think about a few things. So to get started, James, I'd like to hear your thoughts, first of all, on how exactly you define wellness.
You know, Felicia, for years I used to think, I worked in a trauma center for 20 years, and I thought that when we got sick, a doctor would give us a pain medication or a prescription or surgery. And the more I study medicine, the more I know that healing comes from within, not from without. You know, in fact, there's a quote that I was looking at Dr. Fadmer Singh's book, and it basically says science shows that basically even something like a hug slows down the heart rate, reduces blood pressure, accelerates recovery from illness. And they also know that the healthcare system only affects 10% of our health, and the other 90% is from our thoughts, our lifestyle, our meditation, our intention. We even talk about cell signaling. The cells interact and talk to each other. They use various biomechanical signals, and those are based on our thoughts. So we have negative thoughts, and we reproduce millions of cells over time. Almost daily we reproduce cells, and our negative thoughts produce negative cells, and our positive thoughts produce positive cells. But as far as the healthcare industry itself, I personally think that we're seeing more alignment between the chiropractor, the physical therapist, the osteopath, the podiatrist. We're seeing more holistic medicine become mainstream, and we're seeing so much more where we're actually treating, instead of treating a symptom, we're treating it like we would treat a car that has a light on, a warning signal. We're treating the holistic person. We're treating that energetic, spiritual, structural pain pattern, that emotional thing, that we're changing their thoughts so that the cells can actually attack the cancer rather than feed into the cancer. So for me, wellness is becoming redefined. It's becoming something that actually goes against the grain of medicine. I remember Susan Chappell lecture in Canada on research, and she said, that I don't know the exact numbers, but it was roughly 50% of what we currently do in traditional medicine have more negative side effects that outweigh the benefits of the care being given. So this conference with One Concept is the cutting edge of where I see medicine in the future.
Well, I've read that book myself from Fad Mancini, and I know that healing is an inside job. He has some great points in there, and I'm so glad that you brought that up because, he's a chiropractor, but is someone that really believes in the wellness idea of us taking care of ourselves and everyone in our community, being a part of that. It's really fascinating to see that the change with the One Concept conference is really gravitating even more towards the idea of community, how to build community, how to work with the community. And so I'm wondering, just kind of building on that, how do you see the different healing professions working together in a community or collaborating in the future?
What's amazing, Felicia, is back in 1998, before the 2000 Olympic Games in Australia, I taught at the Olympic Training Center in Australia, and I saw everybody leave their egos out the window. They came in, the nutritionists, the sports psychologists, the physios, the acupuncture people, the elite level sports therapists, the chiropractors. They basically left their egos out the door, and what they were interested in is exactly what we're doing with One Concept. They were interested in learning each other's weaknesses, the strengths. I want the strength of all of those other manual therapists. I want my weaknesses to be strengthened by aligning with these people. I want for the best interest of the patient. I don't want our egos to be in the way. Healing comes from within, from a place of love, from a place of non-ego, from a place of, I really, really am trying to facilitate in your body that you feel loved, you feel nurtured, and that I want to align your muscles, bones, ligaments, tendons. That's just a small piece, but I'm saying that as we look at medicine now, This year alone, I'm teaching chiropractic conventions. I'm teaching physical therapy conventions. I'm teaching about 120 people in the athletic training field. And I'm thinking that now they're saying, okay, we learned a certain curriculum in our athletic training or PT or chiropractic, but there's a lot of things we didn't learn about structural integration, posturology, myoskeletal alignment. There's things we didn't learn about treating structurally, getting muscles in balance and, thinking good thoughts. So as I go onto their turf, I bring my strengths, and what I'm hoping as I go to their conferences and attend their classes that they fine-tune my weaknesses. So I think that we're seeing that model that existed in Australia that I was so intrigued with. Unfortunately, when I came back in 1998, there were turf wars amongst all professionals. One person does this, then on a different page is someone doing something that might contradict what the first person does. And even in the field of corrective exercises, before I became a certified personal trainer with the National Academy of Sports Medicine, I had to walk so carefully on, okay, can I give them stretches for tight muscles? Can I strengthen weak muscles? Now, as a certified personal trainer with the National Academy of Sports Medicine, for me, corrective exercises, stretching tight muscles, strengthening weak muscles, getting the joints and the muscles lined up are as vital as any therapies that we do on a massage table.
Without a doubt. I mean, there's so much that we can learn from each other. And I like what you're saying about fine-tuning our weaknesses and really being open to the strengths that others have. With that in mind, and, gosh, with your depth of experience in so many different places, I'm wondering if there's anything in particular, if you could have one change that you would make in the massage and wellness professions, what it might be.
I think that for me there would perhaps be two. One is that we define what our ego is, keep it out of the picture, and we work together for the best interest of every client out there. I said one day in a keynote speech I was doing, can you imagine if we aligned myofascial therapy with visceral, with lymphatic, with posturology, with muscle alignment, with orthopedic, if we put all of these entities together and we had a package of wellness and healthcare, that all of these leaders came together, and when you needed acupuncture, I would refer out to the acupuncturist. If you needed something else, we would work together. We would teach the patient the things, and I think I would number one say I would like to make sure that everybody works together and realizes that we all can complement each other. I also think that just working to change medicine, I think empowering the clients to take responsibility of their musculoskeletal balance, just empowering the clients to be more proactive in their diet, in their thoughts, and in their ability to keep their body lined up. I think those are the changes I would make. One is educating the patient on their level, why they have to step it up and eat better, think better, and do their exercises. And number two, I pray someday that nobody has this attitude of I'm better than you. I hope that everybody realizes, as I was co-teaching with Eric Dalton in my class Saturday at the the National Conference for AMTA, as we taught together, I would bring him up and say, okay, rather than learn this from me, he's the master of this technique. Let me have Eric demonstrate this so that we can cohesively bring the best of the best. Dr. Marcini said, I want you to come and speak at chiropractor. I want you to help write a curriculum. I want you to help fill the gap of things that, capsular work, which has gotten me around the world, releasing frozen hips and frozen shoulders. Those are the things that, as he watched me release a frozen shoulder of a friend of his that injured his shoulder at the 1996 Olympic Games, he goes, wow, this is something that's missing in our profession. I've been in this industry forever, and I've never seen this kind of work. And I think to change that would be amazing.
Well, without a doubt. I think those are some great perspectives. James, you teach a lot of different classes, and you'll be teaching at the upcoming Canadian Massage and Chiropractic Conference in Niagara Falls. I'd love to know how exactly your classes can help massage therapists and other wellness professionals to achieve that level of success, kind of what we're talking about, or just success in their own individual careers, and to stay in business for the long term.
Felicia, I think when there's tough economic times, when you're getting people out of pain, the people that need that spa day can give that up. But when you're hurting, I remember laying on the floor one day and my back was hurting so bad that my wife carried me to my chiropractor. Within an hour of seeing him, I had a zero pain level. So I think what's happening, we've changed all of our videos, all of our books, all of our literature. We no longer call it clinical massage or orthopedic massage. We call it integrated manual therapy, structural approach to pain management. So what I'm bringing to the table at the chiropractic, the conference in the Niagara Falls, is I'm bringing all new stuff. I'm bringing the importance of more thorough assessment. I'm bringing the importance of bringing muscle alignment together with posturology to orthopedic massage. The importance of matching the technique that we apply to that patient to the underlying pathology of each and every specific condition. We're doing, we're doing courses on the lower extremity and ascending syndromes. A lot of people don't understand that when the foot hyperpronates and the tibia internally rotates, it affects knee pain, back pain, spine pain, and neck pain. A lot of people don't understand that when a nerve is compressed in multiple areas, like the carpal tunnel patient, it starts in the neck. It might be compressed twice or three times in the neck and shoulder before it's compressed in the elbow. And by the time it gets to the wrist, it's compressed the seventh time. So I think what I'm bringing to the table is to all of the healthcare providers, those chiropractors, those acupuncture people, and the high end of manual therapy throughout the world, as I'm bringing together assessment skills to help us treat not where it hurts, not the symptom, but the underlying emotional, physical, structural, postural cause of nerve pain, differentiating that from myofascial pain, differentiating that from capsular patterns. And of course, Felicia, what I've refined over the last 20, maybe 30 years is the ability to do the dance between emotional guarding, muscle rebalancing, getting rid of structural imbalances, say in the back, we're treating pelvic stage. So getting rid of sacral torsions that tilt that sacral base, that unlevel those discs, because I don't care how good you are at releasing that psoas. If you have a sacral torsion with an unlevel sacral base, the psoas isn't the culprit of pain. So I'm teaching them to differentiate the skeletal cause versus the muscular cause. And I really believe a lot of chiropractors attending this conference would see new stuff that they never learned in chiropractic training if they step out of the box of the chiropractic tracks and attend these conferences. And vice versa, I would be the one, when I'm not teaching my classes, to step into the chiropractic arena to see what I could do better for the best interest of my patients.
So, in a nutshell, what I hear you saying is that for people to really be successful, they have to consistently strive to be better, to step outside the box of their original training, and to learn more about the other techniques that are out there that can help their patients get out of pain and set them as a therapist or provider apart from their competition.
Absolutely, Felicia. And that's not just saying, okay, Felicia wants to specialize in sports injuries and chronic pain and prolonged injuries, but say there's someone working at a massage franchise, say Massage Envy, whatever, they're working there. Every single person that comes into that massage treatment has some form of minor musculotendinous pain condition. So every single therapist will increase, I used to do spa trainings at Four Seasons and Canyon Ranch, and I believe, this is my thought about the spa of the future, if there was a spa franchise that actually trained their therapists to assess and treat and correctively treat minor musculoskeletal pain conditions, I believe that would be the most successful spa in the world, because we are not just catering to the hospitals and the sports teams, and working with PTs and so on, but we're basically educating those clients. One of the quotes that touched me the deepest, it was in Dr. Dalton's book on dynamic body. It was Dr. Laura Mel Mosley. He said the nervous system controls the fascial system. So we make these changes as on our table, and they're temporary. But when we empower the client to change their diet, to stretch tight muscles, strengthen weak muscles, and do corrective exercises between sessions, the changes they can make are permanent. If I release a frozen shoulder or a frozen hip and I put you in a sling and swap in your shoulder, the capsular patterns come back within 24 to 48 hours. And the beautiful thing, Felicia, everything that I'm going to be teaching is 100% pain-free. So it kind of honors the code of ethics of do no harm. And in doing pain-free therapies, back in the days when we used to think Rolfing equaled pain, even Tom Myers and Eric Dalton are no longer causing pain because the research says that the body negatively responds to pain. So in doing pain-free sessions that get people out of pain, number one, it honors the code of ethics, and number two, it can be implemented into any type of massage session. I don't want you to give up your lymphatic training. I don't want to give up your craniosacral training. I want you to give up your energy work. I want you to believe that there is an energetic, spiritual, structural human being needing love and compassion to facilitate wellness.
Well, I promise that anyone listening who comes to your class or purchases your book or watches any of your DVDs is in for a tremendous amount of information and insight, as well as a great time in your classes. James, I want to make sure, though, that everyone listening can reach out to you in case they can't make it to the conference. We do want to make sure that they can find you somewhere. What's your best contact or website information?
Felicia, we have a full office staff, and we have an amazing updated website. Our website is www.orthomassage, that's O-R-T-H-O massage.net. Our toll-free number is 1-800-643-5543. And even though I travel to 15 countries around the world teaching 40-some weekends and 22 conventions a year, we have this staffed fully so that someone will get back to them within 24 hours. So, again, 1-800-643-5543 or www.orthomassage.net. And we've redone all of our videos so that we could cater to a higher market just this last March. So a lot of new stuff to share with them.
Fantastic. Well, thank you again, James, for being here with me today and, of course, for being a part of the One Concept conferences.
It's an honor, Felicia. It's like family. This whole group is like family to me, and they are the future. And what an honor to be aligning with world-renowned. I met Fab Marcini at this particular conference, American Massage Conference, which is lined up with the Canadian Massage Conference. I guarantee you people will see the who's who of the world, and they will become better practitioners as a result of that at these conferences.
Without a doubt. I want to make sure that everyone listening knows how to be a part of these conferences. So if you would like to learn more from James Waslaski, please join us for the One Concept Canadian Massage and Chiropractic Conference in Niagara Falls, Ontario, Canada, October 18th through 20th. To learn more or to register, just go to www.oneconcept.com. That's the word one, concept.com. You'll find more information and be able to register on the website. Thanks so much for tuning in, and have a fabulous day.